This is something I would highly recommend to any mom who's had a baby before, coming from someone who's currently pregnant with her third and 27 weeks along. So I'm about to go into my third trimester. I'm currently preparing for a birth, labor, postpartum. I've been doing that my whole pregnancy. Like, something I do proactively is try to train for birth. Ever since I learned about the benefits of it, that's something I proactively try to do during pregnancy. And an underrated service provider to hire while you are currently pregnant is a pelvic floor therapist. All right, who's ready to get really TMI, really personal up in here, because I just kind of like spill it all out for you. So because I spill it all out because yes, I'm putting like my information out there, I hope this helps somebody, because as a mom myself and someone who's about to go through her third birth, this is the kind of thing I wish I would have saw, is someone normalizing things that happen in birth, pregnancy, labor, delivery, all the things, because you really don't know until you go through it. So my first birth, I had a 2nd-degree tear, and then my second birth, I had a almost 3rd-degree tear. They still called it a 2nd degree, but it was like borderline. Now, when you tear during birth, there's anywhere from a 1st-degree to a 4th-degree tear, and tearing is basically the perineum, which is like that skin, that layer right between your vagina and your butt, and anywhere in there can tear, and 4th degree is basically you tear front to back. So we didn't quite go there, thankfully. When you tear like I did, what typically happens is they will stitch you up right after you give birth. Then when you go back for your 6-week checkup, they check to make sure your stitches are healing properly, there's no complications, no infection, anything like that. Stitches just like dissolve. Thankfully, both times that I had the tearing and the stitches, like, I had no issues. Like, it healed up, never noticed it. Now, while I am a pre and postnatal fitness specialist and I know what to do with my core, pelvic floor, all those things, this is where a provider who's specialized in the pelvic floor, especially internally, comes into play. Because I had some built up scar tissue that I didn't even know about. I had an internal exam and I noticed I had a lot of pain in certain spots, like pressure, and I have a lot of scar tissue that needs worked out. One of my big goals going into this third birth is I don't want to tear worse. Now, because I've tore the first 2 times, like, the chances of me not tearing at all are pretty slim. But the way my provider put it too is she was like, let's not go any further than a secondary. And to do that, I really need to prepare for birth, preparing to push, preparing my pelvic floor, preparing my perineum. I love the analogy she gave, kind of like a rubber band. Like, if you take a rubber band and just pull it really fast, like, it's probably going to break. But if you slowly stretch it, put it over like your water bottle, like if I put a rubber band around here, let it sit and take it off eventually, it would stretch out. And that's basically what we need to do with my perineum. That's why when it comes to actual birth and like pushing the baby out, you don't want to push super fast and have baby fly through there, because again, it's not giving your body time to like really stretch. Again, pelvic floor physical therapy is great because they can do an internal exam where they help see, like, okay, where in your perineum, where in there in the pelvic floor are there issues, and where can we fix things. This is why I say you don't want to go into birth just winging it. Having some kind of preparation is always beneficial.